So, good morning, everyone. So, I'm here today for the discussion of the important highlights topics which has seen in the BTSC BIHAR Staff Nurse Examination 2025. So, I'm here to discuss some of the important topics. Important highlights in the BNRC Staff Nurse 2025 exam questions that there was 5 to 6 questions from the biomedical waste according to the rules of the 2016 they have highlighted and given the and regarding the color code in yellow what we have to discard like anatomical waste or some of the infectious waste and SAP waste what all things came and like that questions were there. Okay, so BMW from there they have asked 5 to 6 questions and 4 to 5 questions from the vitamin deficiency and their sign and symptoms like vitamin A deficiency night blindness or what all things like that. Okay, and 2 3 questions from the nursing theory, like theory they have asked 21 nursing problems theory that is given by Faid Abdullah. So some of the questions from the nursing theory and their theorist they have asked this theory is given by whom. Okay, in 2 to 3 questions from the immunization vaccines they have given some of the dose related questions and site related questions from the immunization and vaccines they have asked. And regarding the Hirschsprung disease, which gene is responsible for the Hirschsprung disease, and RET gene is responsible, and their surgical management, like we are doing the SOE procedure and Duhamel procedure. Okay, so next questions were from the iodine requirement in the pregnancy and adult. The daily requirement of the iodine in the pregnant lady. There was one question and separate questions for the iodine requirement for the adult. And 2 to 3 questions they have asked from the ECG arrhythmia and they have asked regarding the second degree heart block. Heart block was there. Second degree heart block, Mobius 1 and Mobius 2 like that. They have asked the ECG arrhythmia and some of the antidotes also they have asked like opioids antidotes, naloxone and all, and some of the questions from the poison. And from this solution also they have asked which is isotonic, hypotonic and hypertonic solution, antiretroviral drug used in the AIDS and all. And their classification they have asked which drugs comes under the nucleotide reverse transcriptase inhibitor. So like that they have asked the subclassification. And some of the communicable disease and its incubation period they have asked mainly the rubella, measles, mumps, their incubation period. Most commonly you can see and go through that. And in the pediatric, so language disorder, they have asked the stuttering, stammering, verbigerations, and perseverations. They have asked the cluttering and all. Okay, they have asked some of the acronym also. OCD, OCD का full form क्या था? BPAD का full form क्या था? Bipolar affective disorder, OCD obsessive compulsive disorder, obsessions का meaning क्या था? And child guidance clinic meaning and their mental illness ka definitions they have asked the they have given the 4 options and among that we have to select which is which defines the well regarding the mental illness. And nursing informatics and some of the questions from the electronic health record EHR सिस्टम क्यों यूज किया गया है, इसके क्या एडवांटेज है नर्सिंग फील्ड में. मैनिया से रिलेटेड काफी क्वेश्चंस थे. मैनिया एंड मैनिक पेशेंट्स देयर बिहेवियर, व्हाट आर द सिम्टम्स, दे आर मींस लाइक वेरी एक्सेसिव, बहुत ज़्यादा ओवर एग्जैजरेटेड और काफ़ी हाइपर एक्टिव हो जाते हैं पेशेंट, काफ़ी बातचीत करने लगते हैं, ओवर शॉपिंग करने लगते हैं. तो ऐसे कुछ ऑप्शंस थे. एंड हाइपोथायरॉयडिज्म, हाइपोथायरॉयडिज्म के क्लासिकल कुछ क्वेश्चंस थे लाइक मतलब इसको कैसे हाइपोथायरॉयडिज्म बोलेंगे, लाइक एलिवेटेड टीएसएच और low T3 T4. Okay, rose spot where we can see the rose spot like typhoid. Okay, and regarding the weight lungs where we can see the pulmonary edema and all. In the pulmonary edema we can see the weight lungs. Spatula test कहाँ पे देखने को मिलता है, that is seen in the tetanus. And sample के acronyms पूछे गए थे कि sample में S stands for what, that is sign and symptoms and all. A for allergic and like that. Picot, Picot in research we they have asked the P stands for what. P stands for population, people or like any type of problem. It is research analysis problem. Chopstick sign में कौन से facial nerve का involvement होता है. And in the gynae they have asked the first stage, second stage and third stage labor when to start and finish. They have asked the सेकेंड स्टेज कब स्टार्ट हो रहा है, थर्ड स्टेज कब स्टार्ट हो रहा है, फुल डायलेशन कब किसको बोलते हैं 10 सेंटीमीटर को। बाइसेप्स स्कोर से कुछ क्वेश्चंस थे, स्पाइनल नर्व क्रेनियल नर्व से कुछ क्वेश्चंस थे, लाइक दे हैव आस्क्ड द स्पाइनल नर्व का फुल वो क्या होगा, C7 T12 L5 S5 C1, okay, and some of the questions from the newborn reflexes and its response, like moro reflex पूछा गया था उसमें, moro reflex starter and some of the things, okay, some of the questions. So these were the important topics from where they have asked the important cover all the questions from these many topics. So thank you so much everyone. So you can follow me on the Telegram also, and on the YouTube also, and in the WhatsApp also. Stay connected. Thank you.